Assalamualaikum students. So we'll start. Okay. So today we'll discuss about the anatomy of the female reproductive system as well as the anatomy of the breast. So these are the topics we'll cover. One is describe the different components of the female reproductive system. Describe the anatomy of the female peritoneum in female, and describe the anatomy of the female breast, and describe the structure of the female breast, that is mammary gland. Okay, so this is the picture of the pelvis. Here, this is the part which is called as the pelvis, and these are the organs within the closer look of how the structures are arranged. Here, if you see, this is the urine bladder, and here is the urethra, and this is the uterus, vagina, and these are the fallopian tubes on either side, and behind is the rectum. So these are the structures which are arranged in the female pelvic region. So we'll discuss these important components one by one. Coming to the components of the female reproductive system, it consists of it is divided broadly into internal genitalia as well as the external genitalia. Internal genitalia are those organs that are within the true pelvis. Okay, these includes the vagina, cervix, uterus, uterine tubes. Okay, uterine tubes are also called as the oviducts or the fallopian tubes, and the ovaries. All these are within which are included in the internal genitourinary system. Okay, one is, as you see, this is the vagina part, and this is the cervix, this is the uterus, these are the fallopian tubes. Okay, then we have the main primary organ, that is the ovary. Then external genitalia includes the perineum, the mons pubis, clitoris, the urethral meatus, labia majora, minora, vestibules, the greater vestibular glands, the skinny glands, as well as periurethral area. All these are part of the external genitalia. So broadly, we divide it into internal genitalia as well as the external genitalia. First, we will see the internal genitalia. Later, we will discuss about the external genitalia. As you know, the main primary organ in case of the females will be the ovary. Just like in case of males, it is the testis. In case of the female, these are the ovaries. Okay, so the blue blood structures on either side, these are the two ovaries on either side. They look very similar to that of the testis in size and in structure. They are almond shaped or oval shaped, just like in case of the testis. They are also of the same size, almost 4 into 2 centimeter, 4 centimeters in length and 2 centimeters in breadth. Usually lies against the lateral wall of the pelvis. The only difference is in case of male, the testis will be outside the body within the scrotum, but in case of female, the ovaries will be present within the pelvis. Okay, it will be against the lateral wall of the pelvis in a depression called as ovarian fossa. This will be sitting in a small depression within this peritoneal fold, that is called as the ovarian fossa, bounded by the external iliac vessels above and by the internal iliac vessels behind. Okay, so there will be the iliac vessels which will be running here, so that will be in relation. Coming to the function, just like in case of male, here also there does two functions. One is they help in the production of the female germ cells, that is the ovum, as well as secretion of the female sex hormones, that is the estrogen and progesterone. In case of male, as you saw before, in testes it will be producing the sperms as well as producing the male hormone, that is the androgen or the testosterone. In case of the female, similarly, the female germ cells as well as the female sex hormones, those are the estrogen and progesterone. It is attached to the back of the broad ligament by a peritoneal fold called as the mesoovarium. If you see here, this is called as the broad ligament. Okay, so this is the fold of peritoneum which will be hanging from one side to the other side, and it will also cover the ovaries, and it will have a small extension from here that will be called as the mesoovarium. meso part of the broad ligament. This the whole thing is the broad ligament, and the fold which will be holding the ovaries, that will be called as the mesovarium. Okay, its medial end is attached to the uterus by the ligament of the ovary, and its lateral end is related to the fimbria of the uterine tube. So medial end is attached to the uterus by the ligament of ovary. So it is attached to the, here this is the uterus by the ligament of ovary. Medially, the ovaries are connected to the uterus by a ligament called as the ligament of the ovary. And the lateral end is related to the fimbria of the uterine tubes. And if you see here on the lateral side, you can see these are the fimbriated finger-like projections from the uterine tube. So these are called as the fimbria is singular, fimbria is plural. Okay, so these are the fimbriated end on either side, and these are the ligament of ovary medially. And in between, you can see the ovaries. Coming to the blood supply, the arterial supply is by the ovarian artery, just like in case of the testes, it will be testicular artery coming from the abdominal aorta. Here also the ovaries are, ovarian arteries are coming from the abdominal aorta. If you see here, these are the ovarian arteries on either side. They will be coming directly from the abdominal aorta. Venous drainage is also very similar. The ovarian vein drains into the inferior vena cava on the right side and into the left renal vein on the left side. As you have seen in case of testis, the right the ovarian vein will be draining into the inferior vena cava at oblique angle, but the left ovarian vein will drain into the renal vein and from there into the inferior vena cava. So here also the varicosity, because of the backflow, there can be varicocele on the left side, more common even in case of female, but the commonest will be in case of the female. Okay, so this is the blood supply, arterial supply from the ovarian arteries, and the venous drainage will be from the ovarian veins. Okay, lymphatic drainage, the lymph vessels of the ovary follow the ovarian artery and drain into the para-aortic group of lymph nodes at the level of the first lumbar vertebra. Okay, so the lymphatic vessels will be draining into the para-aortic group of them. Beside the aorta, there will be group of lymph nodes. These are called as the para-aortic group of lymph nodes. Okay, nerve supply. The nerve supply to the ovary is derived from the aortic plexus and accompanying the ovarian artery. So there is a plexus around the aorta that will be called as the aortic plexus. Okay, so that is the nerve plexus, and it is around the ovarian artery, and it comes and supplies the ovaries. Come now going to the fallopian tubes. After the ovary, the primary organ. Now these are the secondary organs. The fallopian, the second important organ will be the fallopian tube, which is also called as the uterine tube or also called as the oviduct. All the names are for the same tube, that is the fallopian tube. The length is almost 10 centimeters long. It is enclosed in the upper border of the broad ligament of the uterus. If you see here, this is the broad ligament, as we said before, is the broad ligament. So it will be present in the upper end of the broad ligament. So this is the fallopian tubes at the upper end of this is the broad ligament. It is divided into four parts. As you know, it is divided into four parts. There is the infundibulum. This is the funnel shaped lateral end that projects beyond the broad ligament and overlies the ovary. The free edge of the funnel has several finger-like processes called as the fimbria. As you can see here, these are the finger-like projections from this infundibulum. You see here, this is the infundibulum. So this is the free end that is called as the fimbriae. Then we have the large important part that is called as ampulla, the widest part of the tube, which is the site of fertilization. Ampulla is very important because that is the site where usually the fertilization takes place. Then we have the isthmus. Isthmus is narrow part. This is the narrowest part of the tube and lies just lateral to the uterus. Okay. And then we have the intramural part. The intramural part is the segment that pierces the uterine wall. This is the, here there will be a small part within the wall of the uterus. The wall of the uterus is thick because of the muscular part. So within that, a small part extending into the wall, that part will be called an intramural. Mural means muscle. So intra means within the muscle. Whatever part of the tube is there, that is called an intramural part. Then it opens into the the cavity of the uterus. So these are the four parts: infundibulum, ampulla, Then we have the isthmus and the intramural part. Okay, coming to the function, site of fertilization of the ovum. So as you know, the ampulla is the most important part where the fertilization takes place, and also the whole tube acts for the transportation of the fertilized ovum into the uterus. This helps in the passing of the sperm and bringing it up to here. Then fertilization takes place. Then the fertilized egg will go back into the uterine cavity. Okay, so all these are the functions of the this long tube, that is the fallopian tube. Now coming to the uterus. So this is the uterus here. It is a hollow cavity because there is a cavity inside. So if you can see, this is thick wall, very thick wall. Okay, that is the muscular part, and a big cavity is there inside. That is the hollow cavity. So a hollow pear-shaped muscular organ is the definition of the uterus because it is highly muscular. So it is a muscular organ with hollow cavity inside. Size in the young nulliparous means are those ladies who have never become pregnant, who have never become pregnant before. Okay, so in those such kind of female, it will measure just 3 inches into 2 inches into 1 inch, 3 inches in length, 2 inches in breadth, and 1 inch in the thickness. So this will be the size, and it will be a pelvic organ. Okay, but if the lady becomes pregnant, this uterus becomes very much enlarged because it has the capacity to uh, hyperplasia as well as hypertrophy. Then it becomes a pelvic organ, not only pelvic, it becomes abdominal pelvic organ, and then the size will be much more bigger, huge size. Okay, so but in case of nulliparous, it will be just 3 inches into 2 inches into 1 inch. It is divided to fundus, body, and cervix. There are three parts for this whole of the uterus. One is the fundus, this is the body, and this part is called as the cervix. Fundus is the part of the uterus that lies above the entrance of the uterine tubes. If you see here, there are two uterine tubes or fallopian tubes opening. Above that, whatever part is there, this is called as the fundus. Then the part of the uterus that lies below the entrance of the uterine tube, cavity, where the cavity is there, triangular cavity, this is the cavity in triangular. So that part is called as the body of the uterus. The body is the fundus. And the lowermost part, the cervix, the narrow part of the uterus, it pierces the anti-wall of the vagina and divided into supravaginal, vaginal part. Okay. So if you see here, this is the narrowest part of the uterus, which will open into this is the vagina, and a part of the cervix goes into the vagina. This is called as the vaginal part, and this is part above that, this is called as the supravaginal part. So it has two parts: supravaginal part of cervix and vaginal part of cervix. Whatever part of the cervix is in the vagina will be called as the vaginal part. Its cavity is fusiform. If you see here, the cavity of the uterus is triangular in shape, but the cavity of the cervix is fusiform. Means at the center it is broad, and the upper end and lower end. This is the internal os, this is the external os. Between the internal and external os, this part will be very narrow, and in the middle part it will be broad. So this part is called as this shape is called as fusiform shape. The cervical canal, if you see from outside, okay, so you have seen already this is the cervical canal, which is fusiform, the cavity of the cervix. The cervical canal communicates with the cavity of the body through the internal os, with that of the vagina through the external os. As I said, the part of the vagina, the cervix, which is opening into the vagina, that is called as the external os. That is the opening. So this is how it looks like. Initially, in case of the nulliparous, it will be rounded, but after the delivery of the baby, first baby, this becomes broad. Okay, so it will, in case of nulliparous, it will be rounded. In multiparous, it becomes broad. Okay, so this is the opening. This is how it looks like when you see it from the vagina. So this is called as the external os. The other internal opening into the uterine cavity, so that will be called as the internal os. So all the area between the internal os and the external os, that will be called as the cervix. Before birth of the first child, the external os is circular. As I said, before the first birth, it will be circular, but after the first birth, it becomes broad. In paraswomen, the vagina part of the cervix is larger, and the external os becomes a transverse slit. Okay, so that it possesses an anterior lip and posterior lip. So it will include this part will be called as the anterior lip. This will be called as the posterior lip now. Now coming to the important relations of the uterus. So as you can see here, there is the uterus here and there is the vagina. So anteriorly we have the anterior fornix of the vagina. So here if you see here, vagina will be here. So anteriorly the anterior cervix of the fornix of the vagina. Fornix means small space between the cervix and the vagina. That will be called as the fornix. The posterior fornix of the vagina. Posteriorly, we have the posterior fornix. Anteriorly, we have the anterior fornix, anterior space. This is the posterior fornix. The space between the posterior wall and the posterior vaginal wall. Okay, so this is called as the posterior fornix. Laterally, we have the lateral fornices. Lateral fornix. Anterior fornix, posterior fornix, and lateral fornix. There are two fornices. Coming to the body, fundus, and supravaginal part of the cervix. Anteriorly, we have the superior surface of the inner bladder. If you see here in the front for this part of the fundus, body, and supravaginal part of the cervix, you can see we have the urinary bladder in the front. Anteriorly, we have the superior surface of the urinary bladder. Posteriorly, if you see, this is the sigmoid colon. This is the sigmoid colon here. So posteriorly, we have the sigmoid colon. Laterally, we have the uterine artery from either side. And the vaginal part, if you see, this is the vaginal part, cervix surrounded by the vaginal fluid. So it is divided the part fundus, body, and supravaginal part, and the vaginal part. The vaginal part, we have the anterior fornix, posterior fornix, and lateral fornixes. So these are some of the important relations of the uterus. Now coming to the position of the uterus, the normal position of the uterus, as you know, is anteverted anteflex. So this is the position of the uterus. This is called as anteverted anteflex. What do you mean by anteverted? So anteverted means the angle between the long axis of the vagina and the long axis of the cervix. This is 90 degree, and this is called as the angle of anteversion. Angle of anteversion. Then we have this part, the long axis of the cervix and the long axis of the uterus. This angulation is called as anteflexion. So this position, this is the normal position of the uterus. It is anteverted, anteflex. This is anteversion, which is 90 degree, and anteflex, which is obtuse, more than 90 degree, less than 180 degree. This is called as the anteflexion. So this is the normal position of the uterus. Okay. So anteverted, long axis of the whole of the uterus is forward on the long axis of the vagina. Okay. So this is called as anteverted, and it's like long axis of the body of the uterus is bent forward on the long axis of the cervix. This is called as the angle of anteflexion. Okay. So anteflexion, anteversion, this position is the normal position of the uterus. Now there can be abnormalities within this. Okay, so there can be changes which are abnormal positions. One is the retroverted position, retroverted uterus. The fundus and body of the uterus are bent backwards on the vagina and lie in the rectouterine pouch. As you can see here, they are bent back. Normally this is the position, but sometimes it can bend and behind, and it can lie in the retroverted flexion. The retroflex uterus, long axis of the body of the uterus is bent backwards on the long axis of the cervix. So it is totally bent backwards. Okay, this becomes straight, and these are all abnormal position of the uterus, which can lead to infertility. It can lead to infertility. So it should be always in this position for the normal functioning of the uterus. So that is the anteverted anteflex. That is the normal position. Now coming to the blood supply of the uterus. So it is supplied by the uterine arteries. Artery supplying the uterus will be, this is the uterine artery. So there are two uterine arteries, one is from the right, one from the left. Okay, then it will be giving branches. Okay. The uterine arteries are the main arteries which are supplying the uterus, arise from the anterior division of the internal iliac artery. They are branches from the internal iliac artery. In the base of the broad ligament, crosses above the ureter, half an inch lateral to the supravaginal part. Just a half a inch above the supravaginal part, it will be turning laterally. If you see here, so this is the supravaginal part of the cervix, and here you can see the uterine artery. So it will be giving two branches. One is ascending artery and descending. This is the ascending artery, very zigzag, and this is the descending artery. It is very tortuous artery. Why it is tortuous? Because once the uterus becomes larger and larger in case of pregnancy, this artery, if it is straight, then it will rupture. So this has the capacity, just like the uterus has the capacity to expand, then this artery can become straight and still keep supplying the uterus. That's why it is very much tortuous. Okay. There are very few arteries in the whole body which are tortuous. Okay, so one of them is the uterine artery. An ascending artery, this is the ascending artery, one is the descending artery. Then coming to the venous drainage, it starts as a plexus between the two layers of the broad ligament, pampaniform plexus. You see here, there is plexus of veins, many veins all joined together, finally drain into the uterine vein. So this plexus of vein, this is called as the pampaniform plexus. If you remember, similar pampaniform plexus was there in the testis also, around the testis as well as the spermatic cord. Similarly, we have the pampaniform plexus here also. Starts as a plexus between the two layers of the broad ligament. So this is the broad ligament. In between the two layers of the broad ligament, we can see the pampaniform plexus. This is the plexus of veins that communicate with the vesical plexus and drains into the uterine as well as the ovarian veins to the internal iliac vein. So they drain into the uterine vein and ovarian vein is here. Okay. And finally they drain into the internal iliac vein. So this is the blood supply of the uterus. Coming to the nerve supply of the uterus, the cervix and the body are relatively insensitive to touch, cutting as well as burning. You should remember that it is insensitive to touch, cutting and burning. So when you do surgery, when you do the laparotomy and try to uh, uh, remove the fetus in case of the cesarean section, you should remember that cutting, touching and burning will not affect the uterus and you don't feel pain, but it has stretch receptors which is sensitive to dilatation, and the body is sensitive to distension. Because of the stretch receptor, it is sensitive to this stretch, not to the touch, cutting and burning. So the cervix is the most important part, which around the delivery after 9 months, the cervix becomes very sensitive, and as soon as there is dilatation, then it starts expanding. So cervix is sensitive to dilatation and body is sensitive to distension, but it is insensitive to touch, cutting and burning. Coming to the innervation, the parasympathetic is from S2, S3 and S4, and sympathetic is from T5 and T6, that is for the motor, and for the sensory it is T10, T11, T12 and L1. Okay. Both reach the uterus through the branches of the inferior hypogastric plexus. The plexus which will be supplying the whole of the uterus will be the inferior hypogastric plexus. Both includes the sympathetic and parasympathetic, because it is autonomic nervous system which is supplying the uterus, so it will be having both the components. Now coming to the uterine and cervical ligaments, there are three important ligaments: broad ligament, round ligament, as well as the ovarian ligament. As you have already seen, this is the broad ligament here. So the broad ligament includes the meso-ovarian as well as the mesosalpinx and meso-ovarum. Okay. So mesometrium, meso-ovarian means the ovary, the peritoneal fold covering the ovary, and the mesosalpinx means the fold of peritoneum covering the salpinx, that is the uterine tube, and the mesometrium means the part which is covering the uterus. So all these three includes within the broad ligament of the uterus. Then apart from that, there are other ligaments like the round ligament. Very important ligament is the round ligament. This is the round ligament which will pass through the inguinal canal, and it will be one of the very important components which will be holding the uterus in its normal position. That is the anteverted anteflex position. Okay, that is the round ligament. So it will be pulling the uterus forwards and that will be the main reason why the uterus is in anteverted antiflex position. Then there is also the ovarian ligament. Okay, so if you see here, so this is the ovarian ligament. Okay, so here if you see this is the ovarian ligament, this is the round ligament. So if you can differentiate between the ovarian as well as the round ligament of the uterus, the round ligament as well as the ovarian ligament. So these three ligaments are very important ligaments which are in relation to the uterus. Now we'll study these ligaments one by one. One is the broad ligament. As you can see here, this is the broad ligament. It is nothing but a peritoneal fold which is hanging on the uterus, covering the uterus from front and back, as well as the fallopian tubes also. Okay, the broad ligament is a double sheet of peritoneum that extends from the lateral wall of the uterus to the lateral pelvic wall. So it extends from the lateral wall of the uterus to the lateral pelvic wall. Its outer part forms the infundibulopelvic ligament in which the ovarian vessels traverse their way to the ovary. So if you see, these are the two folds of the peritoneum, and in between will be the passage of the ovarian vessels, ovarian artery as well as the veins. So what are the contents of the broad ligament? It not only contains the ovarian vessels, uterine vessels, also the ureter, round ligament, parametric lymphatics and lymph nodes, sympathetic and parasympathetic lymph nerves. All these will be within these two folds of the peritoneum. Ovarian vessels, uterine vessels, ureter, round ligament, the lymph nodes as well as lymphatics, as well as the nerves, sympathetic and parasympathetic nerves. So that was about the broad ligament. If you cut this broad ligament, then deep inside you can appreciate the round ligament. This is the real round ligament, which I said is very important ligament, which will hold the uterus in its normal position. It's a fibromuscular ligament. So the broad ligament was a peritoneal ligament. So this was a peritoneal ligament, broad ligament, but the round ligament is a fibromuscular ligament attached to the uterine column. You see, it is attached to the uterus. Runs downwards and forwards in between the two layers of the broad ligament to enter the inguinal canal. So as I said, it is one of the component in case of female, one of the component of the inguinal canal is the round ligament via the internal inguinal ring and comes out to the external inguinal ring to be inserted in the upper part of the labium majus. So it passes through the internal inguinal and then passes through the external inguinal ring and attached to the labium majus. That is the external genitalia. So it will be pulling the uterus forwards and help keeping it in anteverted position. As I said, round ligament. This ligament has a very important role in keeping the uterus in its normal position, that is anteverted anteflex position. Hmm, the ovarian ligament, it's a fibromuscular ligament that attaches the inner lower pole of the ovary to the column of the uterus. It plays no role in pelvic support of the uterus. If you see here one more ligament, that is the ovarian ligament, which is connecting just the ovary to the uterus. So it has no role to play in holding the uterus itself. It is holding only the ovary. So these are about the three ligaments, that is the broad ligament, round ligament, as well as the ovarian ligament. Then apart from that, there are other ligaments which are called as the which are attached to the cervix and hold the cervix in its normal position. This is the pelvis and this is the cervix, and there are three important ligaments which are pulling from all the sides and keeping in the exposition. So here you can see this is the broad ligament. Apart from broad ligament, there are three cervical ligaments. Which are those? One is called as the McEnroe's, the cardinal ligament of the cervix, spread out on the lateral side. Okay, so this on either side, this is called as the cardinal ligament, which is pulling from either side. Then we have in the front we have the pubocervical. If you see here, this is the pubocervical. This is the pubis, so attached to the cervix, so it is called a pubocervical. Behind we have the uterosacral ligament, which is attached to the sacrum, and in the front it is attached to the uterus. So uterosacral, pubocervical, and the cardinal ligaments. All these ligaments are pulling the uterus and the vagina in all the directions and keeping it in position. So these are the three important ligaments, cervical ligaments. One is the McEnroe's, which is also called as the cardinal ligament of the cervix, then the uterosacral ligament and the pubocervical ligament. These three ligaments are very important in keeping the uterus in its position. Okay, now coming to the pelvic floor. So if you have any doubts still here, you can ask me. If you have any doubts,
Thank you, Dixon.
Okay, sir.
no doubts. Okay, so we'll go further. So now coming to the pelvic floor. So this is the pelvic floor. So all tissues lying between the pelvic cavity and the surface of the vulva and the perineum. This is the vulva seen from outside, vulva and the perineum. So all tissues lying between the pelvic cavity. So pelvic cavity is here and the surface of the vulva. Okay, outside that our external. Okay, so all these structures within that is called as the pelvic floor. How it is formed? Very important structures are there which are holding the uterus in its position, which form the pelvic floor, which should be strong, okay, so that there can be normal delivery. Sometimes this pelvic floor breaks and there can be the prolapse of the uterus. The uterus will come down if this is broken down. Okay, so you should know what is pelvic floor. So it is nothing but the pelvic peritoneum. One is the peritoneum, which doesn't have much importance because it is just a peritoneal fold. Then the extraperitoneal fat and cellular tissue, which will be in between. Then the levator ani. One of the very important muscle is the levator ani. If you see here, this is the levator ani, which is holding the uterus in its position. Levator ani muscle and their facial codes. So on either side there are facial codes. Okay. Then the triangular ligament, which is called as the urogenital diaphragm. If you see here, here will be the urogenital diaphragm. Okay. The perineum muscles and their aponeurosis, subcutaneous tissue, fascia, fat, as well as outside we have the skin. Okay. So all these are forming the pelvic floor, but the most important muscles will be the levator ani as well as the urogenital diaphragm, uh, which will mean which are the main components of the pelvic floor. Now coming to the pelvic diaphragm, this is how it looks like. This is the muscular structure, pelvic floor as I showed you here. This is the pelvic floor, which is muscular in nature. So this is how it looks like. The pelvic diaphragm, it is formed of the levator ani muscle and the fascia which cover the upper and lower surface. So the levator ani muscle have three parts. One is called as the ischiococcygis. Okay, ischiococcygis, ischium is here and the coccyx is here. So the muscle fibers coming from the ischium to the coccyx, those are called as ischiococcygis. Then we have the iliococcygeus. Okay, then we have the ilium. Here is the ilium part, fibers coming from there. That is called as the iliococcygeus. Then we have the pubis. This is the pubis. So the muscle fibers coming from the pubis and going to the coccyx. These are called as the pubococcygeus. So there are three directional fibers which are all forming the thick muscular floor. Okay, ischiococcygis, then iliococcygeus and pubococcygeus on both the sides, which will form a strong pelvic floor. It is traversed by the urethra, vagina, and the rectum. So this floor is totally closed except for these openings for the urethra and the vagina in the front and the rectum in behind. So here will be the urethra, then we have the vaginal opening, and this will be the rectum. Except that all other parts are covered by this muscular floor that is called as the pelvic diaphragm, or it is formed by the levator ani muscle, which has these three components. It provides support to the pelvic organ. So it not only provides support to the uterus, which is above it, but also the other pelvic organ. So if there is any damage to this pelvic floor, then all the organs might protrude out. So it happens in some of the conditions where there will be prolapse of the uterus and other things. Okay. So pelvic floor being strong is very important. Now finally coming to the vagina. So this is the vagina as you can see here. It is a fibromuscular tube. It is a copulator organ, extend from the external os along the pelvis and perineum to open into the vulva. So this is the vulva here. Okay, female external genitalia behind the urethral opening, just behind the uterus. This is the urethral opening. Behind that is the external vaginal opening. So the length of the vagina, it is different for the anterior wall and posterior. It has two walls. Anterior is the anterior wall, then the posterior wall. Anterior wall is 7.5 centimeters, but the posterior wall is 9 centimeters, very long, and it has the capacity to expand more. Okay, so anterior wall is shorter, 7.5 centimeters, but the posterior wall is 9 centimeters, very long. Function, what is the function? One, as I said, it is a copulatory organ, and second important function will be it acts as the birth canal. Okay. Coming to some of the important relations of the vagina, these relations are important, especially if you are doing some surgeries on the vagina, or if there are any carcinoma of the vagina, cervix, then these relations are very important because it can affect these organs. So what are the organs which are in the front? As you know, anteriorly we have the bladder in the pelvis and the urethra in the peritoneum. If you see here, anterior wall of the vagina is in contact with the bladder. In the upper part, in the lower part, it will be the urethra. In the perineum, it will be perineum. The pelvis, it will be the main bladder. Posterior wall, in the pelvis, it will be the rectum, and in case of the perineum, it will be the anal canal. The anal canal will be the rectum. So in the upper part, it will be the rectum, and in the lower part, it will be the anal canal. And laterally, we have it will be related to the ureters on either side. Okay, so these are some of the important, especially the anterior and posterior relations are very important. In the upper part, the bladder, and the lower part, it will be urethra. The posterior wall, it will be the rectum, and in the lower part, it will be the anal canal. These are some of the important relations of the vagina. Now coming to the blood supply of the vagina, it is arterial supply by the vaginal arteries from the internal iliac artery, which is present in the pelvis. Venous drainage will be into the vaginal plexus, again back into the internal iliac veins, and the lymphatics will be to the internal iliac lymph nodes. So everything is here in case of because vagina is a pelvic organ, so all are supplied by the internal iliac artery, drained by the internal iliac vein, and lymphatic is also from the internal iliac group of lymph nodes. Now coming to the vulva, that is the external genitalia. Okay, so what are the important structures which you find here? One is called as the mons veneris, a pad of fat covering the symphysis, pubis, and covered by the skin and the hair. This part, this is called as the mons pubis, or also called as the mons veneris. This part is filled with fat, and it is covered by skin and hairy skin here. Okay, then we have the clitoris. Just below that, here this part is called as the clitoris. It is an erectile cavernous structures below the symphysis pubis. So this one, clitoris, formed of small glands and two corpora cavernous, just like in case of male. So this is the female pelvis. Clitoris is the female pelvis. Sorry, female penis. Okay, this is the clitoris is the female penis because it has the gland as well as the two corpora cavernous. Just like in case of penis, here also they are there, but they are very short and very small. Okay, so it is not grown here, but in case of the male, it is quite large. Okay, but here it is just a small rudiment, but still it is has the erectile function. Okay. Then we have the labia majora and minora. If you see around, there is a thick pad of fat covered again by the skin. This is called as the labia majus or labia majora. The outer two skin folds are raised by the underlying fat and passing back from the mons veneris to the perineum. The outer skin is covered by hair, while the inner medial surface is smooth, hairless, and contains sebation and sweat glands. Inside, if you see, it will be hairless and it will contain the sebaceous and sweat glands. Then inside there is a thin fold of skin. This is called as the labia minora. Two thin folds of modified skin situated medial to the labia majora, and they are devoid of fat. So here there will be a lot of fat, but here there will be no fat. So that is the difference between majora and the minora. Then finally, there are some important structure. One is the hymen. This is the hymen here, which is prominent in case of the in girls. Okay, a membrane situated around 2 centimeters from the vestibule that demarcate the external from the internal genital organs and partially closes the vaginal orifice. So it will be covering the thin fold of membrane which is covering the vagina. Okay, so this is the vaginal opening and this is the hymen. Then we have something called as the Bartholin glands. These are greater vestibular glands, bilateral, composed of the racemose glands. If you see here, okay, Bartholin glands here. So these are the Bartholin glands. There are also one more type of gland. These are called as the skin glands. We'll talk about that. So Bartholin glands are the greater vestibular glands. Bartholin glands are the greater vestibular glands. They will be present over here. Secrete mucus during sexual excitement. So they will be secreting the mucus during the sexual excitement. Situated deep in the labia majora at the junction of the posterior and middle thirds. And its depth is 2 centimeters long and opens between the hymen and the labium major. So here is the labium minora, this is the labium majora, and here is the hymen. And in between it will be opening here just 2 centimeters. Then we have the vestibule, the area between the inner aspect of the labia minora and the forehead. So this whole area is called as the vestibule between the two labia minora. Structure that open into the vestibula of the urethra, the Bartholin glands, and the vagina. As you can see here, this is the here is the clitoris, and here is the urethra. This is the vagina, and the Bartholin glands will be behind. So these are the three important structures which will be opening into this vestibule. Then we have vestibular bulbs, oblong masses of erectile tissue that lie on each side of the vaginal introitus. So this is the introitus, and just beside that. Then we have the external urethral meatus. So this urethral opening is called as the external urethral meatus. It is triangular slit in the anterior part of the vestibule between below the clitoris. So here is the clitoris below that, in which the urethra opens. Then we have these skinny glands, as we saw here. These are the skinny glands here, which are beside the urethra. So, two blindly ending paraurethral tubes which open in the floor of the urethra a few millimeters from the external urethral meatus. So, there will be small glands which will be opening here. Then, finally, going to the female breast. Female breast. Okay. So, uh, the female breast or the mammary gland, it is conical in shape. It looks like a cone. So if you see here, it becomes sharp here and broad much here. So it looks like a cone shape. It has a base, apex, and tail. Okay, the axillary tail. This part is called as the axillary tail, which will go into the axilla. So that's why it is called as the axillary tail. Okay. So then it has an apex which is near the nipple and the urethra, and the base where it is in contact with the chest wall. Its base extends from the second to the sixth ring. So if you see, this is the base which is attached to the wall of the chest wall. It extends from the second to the sixth ring, and it has no capsule. It is within the superficial. It is a superficial within the superficial connective tissue, and it is not covered by any capsule. Location, it is present in the, as I said, in the superficial fascia of the chest. Okay, it extends from the lateral margin of the sternum to the mid-axial line. So it extends from the mid-axial line from the lateral margin of the sternum, beside the sternum, from the sternum up to the mid-axial line. That will be the extension of the mammary gland. Above, from the second to sixth rib, and here from the lateral side of the chest wall, that is the sternum, up to the mid-axial line. Two-thirds of its base lies on the pectoralis major, while its inferolateral one-third lies on the serratus anterior and the external oblique muscles. Okay, so it extends from the serratus anterior to the external oblique muscle. Its supralateral part sends a process into the axilla called the axillary tail or the axillary process. As you have seen, this is the axillary tail or the process. Then coming to the nipple and the areola, this is the nipple, and around that pigmented area, that is called as the areola. Nipple is a conical eminence, so this is the conical eminence that projects forwards from the anterior surface of the breast. The nipple lies opposite the fourth intercostal space. You should know where exactly it lies. It lies in the fourth intercostal space. and it carries 15 to 20 narrow pores on the lactiferous duct. If you see, there will be multiple pores. It is not a single opening, but multiple pores, 15 to 20 narrow pores of the lactiferous duct. Then around that is the pigmented area, dark brownish circular area of the skin that surrounds the nipple, that is called as the areola. The subcutaneous tissue of the nipple and the areola are devoid of fat, so there is no fat on the nipple as well as the areola, as well as it is also devoid of the hair. Then we have this is the side view of the breast showing you the internal structures. So it is non-capsulated, so there is no capsule around the mammary gland. It has fibrous strands which run radially and connect the skin with deep fascia of the pectoralis major. There will be fibrous strands here. These are called as the ligamental, uh, the, uh, the suspensory ligament of Cooper. Suspensory ligaments of Cooper. Okay, in between there will be bands which will connect the skin to the deep fascia. Consist of lobes and lobules which are embedded in the subcutaneous tissue pad of the superficial. If you see here, these are called as the lobes. Within them, there are the lobules are there. So all these lobes are draining into one duct. Okay, each lobe will drain into one duct. It is separated from the deep fascia surrounding the underlying muscle by a layer of loose alar tissue which forms the retromeral space. You see here, this is the chest wall and this is the pectoralis major. It is separated from the mammary gland by a thick pad of fat. This is called as the retromeral space of bursa, or it acts as a bursa, so on which the mammary gland can easily move. So it is formed of 15 to 20 lobes. As you can see here, there are 15 to 20 lobes. This is one lobe which is draining into the one duct, the second lobe draining as a duct, third lobe draining into the duct. So they are formed of 15 to 20 lobes. Each lobe is formed of a number of lobules. So each lobe is made up of a number of lobules. All these lobules drain into one lobe. Okay. The lobes and lobules are separated by the interlobular and interlobular fibrous and fatty tissue called as the ligament of Cooper. As I said, there are suspensory ligaments which will separate the lobes and lobules. The infiltration of the ligaments. Okay. The infiltration of the ligaments of Cooper by breast cancer leads to shortening due to purity orange appearance. This the skin of the mammary gland, if there is purity orange. Okay. So if there is any carcinoma, deep lying carcinoma, it leads to shortening of the suspensory ligament and it will pull the breast, and this is how it looks like an orange. Okay, so that's what is called as purity orange appearance of the breast. Okay. It has from 15 to 20 lactiferous ducts which open in the same number of openings on the summit of the nipple. If you see here, all these lobes are opening through each duct, and there are 15 to 20 lobes, so there are 15 to 20 lactiferous ducts. All open here, they open, before opening they become broad, this is called as the lactiferous sinus, and they finally open separately. Okay. Okay. The lactiferous ducts are radially arranged from the nipple, so incision of the gland should be made in the radial direction. This is for the surgeons. If you see here, these are the different lobes. Okay, all are arranged like a radial of your car or a wheel of the car. Okay, so if you are doing any surgery, it should be the incision should be like this, radial incision. Instead of cutting like this, if you cut like this, all the lobes are cut. So whenever the incisions are taken on the breast, it will be radially. Okay, this is for the surgery. When you go to the surgery, at that time we'll study more. Okay, coming to the blood supply. So the arterial supply is by the perforating branches of the internal thoracic artery. So this is the internal thoracic artery, or also called as the internal mammary artery. Again, perforating branches. All these are the perforating branches. Okay. So then the mammary branches of the lateral thoracic artery, the lateral thoracic artery being the mammary branches. Then the mammary branches of the intercostal artery, the intercostal artery within the costa, between the costa, there will be intercostal arteries. So all these are supplying the breast. So breast is a highly vascular organ. Venous drainage, veins are corresponding to the arteries, so the veins are similar to that of the arteries with the similar names. Circular venous plexus are formed around the base of the nipple. Initially, they form a plexus around the base of the nipple. From there, they drain into the corresponding vein. Finally, veins of this plexus drain into the axillary and internal thoracic vein. Okay. Coming to the lymphatic drainage, they all drain into the apical group of axial group of lymph. They will be draining into the axial group of lymph nodes. Almost 75% drain into the central and lateral part of the breast. So here, so if you see here the pectoral group of lymph nodes, almost 75% drain into them. Okay, and around 25% will drain into the medial part, into the parasternal group of lymph nodes and other group of lymph nodes. From there, from the parasternal group of lymph nodes, they cross to the other breast. So the breast carcinoma in one gland can easily cross to the other side. Also, they can drain into the subdiaphragmatic lymphatics. So these are the axillary group of lymph nodes which you already know, and the mammary gland will be draining almost 75% draining into these axillary group of lymph nodes. Okay, so there are different group of lymph nodes. We have the anterior, which is also called as the pectoral group. Then we have the posterior, which is also called as subscapular. Then the lateral group of lymph nodes, which are near the humerus, the brachial group. Then the central. Finally, all these drain into the apical group of lymph nodes. So these are the five group of lymph nodes which form the axial group of lymph nodes, where the mammary gland drains. Okay, so they form a plexus before they drain into these group of lymph nodes. They form subareolar plexus, just like the venous veins form a plexus around the mammary gland. So similarly, there is a plexus around the areola that is called a subaerial lymphatic plexus, and they drain into the lymphatic plexus, and from there into the different group of lymph nodes. Okay, so this is all about the female reproductive organs as well as the breast. So if you have any doubts regarding this, you can ask me now.
All clear, Dr. inshallah. Inshallah, all clear.
Okay, thank you very much.